Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I am currently completing my placement with the Organization for a Safer Space. Today, I will be talking about burnout. In this video, we'll first look at what burnout is. We'll then look at some statistics, causes, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. What is burnout? American psychologist Herbert Freudenberger coined the term burnout in the 1970s. The term was used to describe the effects of severe stress and high ideals in helping professions, such as doctors and nurses. Currently, burnout is used for all types of careers. Burnout is defined as emotional, mental, or physical exhaustion, decreased motivation and performance, and negative attitudes about oneself. It is the result of chronic workplace stress that has not been managed. Burnout can cause one to feel emotional and have difficulty functioning at work and other areas of life. Statistics. According to a poll, approximately 1/4 of employees reported experiencing burnout often or always. 44% reported experiencing burnout sometimes, while less than 1/3 of employees did not experience burnout. Risk factors and causes. The key criterion for having burnout is that a person's occupation must be directly related to a person's declining mental, emotional, and physical health. Common causes for burnout include a heavy workload. A workload that is unmanageable and constantly requires high-quality work can lead to feelings of hopelessness. Time pressures, lack of support from management, experiencing discrimination or unfair treatment. People who are treated unfairly at their workplace are 2.3 times more likely to have a high level of burnout. Lack of role clarity. Only 60% of employees understand the responsibilities and the expectations. A lack of clarity regarding one's role or constant changes to one's role can cause stress. A lack of autonomy, which can occur in jobs with unvaried processes, no control, and no room for innovation, which can lead to low morale, a lack of motivation, and frustration. Inadequate rewards, poor interpersonal relationships, managing distressing situations or material. Social workers and therapists, for example, may be emotionally affected by sensitive, triggering, or upsetting accounts shared by service users, and having a work and life imbalance. Symptoms. There are psychological and physical symptoms of burnout. People experiencing burnout may have the following symptoms: dissatisfaction with work activities, negative attitude about one's job, decreased work performance, depressed mood, anxiety, cynicism, frustration, emotional numbness, difficulty concentrating, feeling of worthlessness, and loss of interest in activities that typically bring joy. Physical symptoms can include fatigue, headaches, gastrointestinal issues, hypertension, sleeping problems, muscle tension, and a weakened immune system. Effects. If unaddressed, severe burnout can lead to poor work performance, relational problems, anxiety, insomnia, heart disease, substance use disorder, major depression, and suicidal ideation. Treatment. A good first step to manage burnout is to see a therapist. A mental health professional can provide support and help one build skills to increase one's sense of self-efficacy and recovery. This can be done with psychotherapies such as cognitive behavioral therapy. Cognitive behavioral therapy helps one to identify and challenge distortions in their thought patterns. Medication may also be prescribed from a psychiatrist. Coping strategies. Changes in one's work setting can help with the recovery from burnout. A person can talk with a human resources department or a supervisor to discuss investing in a healthier work environment. Change their job or switch tasks. Take a much-needed vacation from work. Have scheduled and regular breaks. Create boundaries and say no when they should. And disconnect from work when at home. Other ways to cope with burnout include engage in problem solving, seek support, reinterpret stressful situations in a positive light, exercise regularly, Practice mindfulness by being emotionally present and practicing deep breathing. Write a to-do list and create manageable goals. Find a hobby to find satisfaction outside of work. Volunteer, join a club, engage in self-care such as getting enough sleep, practice gratitude, engage in faith practices, and spending time with friends and family. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the organization For a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.